I'm going to try and do three things in this talk. Firstly, I'm going to talk about the benefits of accreditation, largely based on our research at the University of New South Wales, but also based on my knowledge of the research on accreditation elsewhere. Then I'm going to talk about the benefits of having collaborations of researchers and accreditation bodies like IKAS, in our case using Australian examples, to try and say maybe that's the best of both worlds. Maybe it's the best of both worlds when you have highly skilled people who are running accreditation programs and refining and improving them, and looking at standards and the way the standards get assessed, and trying to improve care through an accreditation process. But also if you add into the mix that you would investigate that and do research running alongside that to strengthen the next generation of accreditation, that might be a very good model. It's certainly the model we've been working on, as Carsten says, for the last 10 years. And we've found that a very useful model. It also means that maybe you generate some data and you get to go to an international conference like ISQA, which is very useful. Not that I'm inviting all your staff to be getting funded to go to ISQA, but it is very useful to be able to do that. So let's just begin that talk by thinking through something. So let me ask you a question. Is IKAS a regulator or a stimulator of improved care? Is it a regulator or an accreditor?
Well, if you think...
What's your name?
Keaton.
Hi, Keaton.
If you think from our side,
yes,
I would say we are stimulus. But if you were another stakeholder in Denmark, you would say another thing. I think that's a big issue. That's how people look at us.
So
we try to be stimulated.
So if you're IKAS,
Yeah.
right, you might say to the system, we're really your friend.
Yeah.
We're trying to stimulate improvements.
Yeah. And they would say, no, you control.
Yes, so if you're a health provider, you might say, oh, look at IKAS, issuing all these indicators and issuing all these standards, making us comply, making us perform. Yeah, so it's interesting. You're right. The answer to the question is it depends whose perspective you're looking from. But certainly if I compare IKAS to many other countries have a much more regulatory sort of approach, where they carry a big stick and essentially say, you must comply, bash you over the head. And IKAS didn't evolve historically as that kind of model. Okay, however, the health system across the world has said we need some level of stimulation or motivation or regulation or accreditation or whatever it might be. Because we've, across the world in the last 30 years, realized that the care that's being provided could be improved. The care that's being provided everywhere, your country, my country, other countries, delivers some sort of harm as well as good care, or the quality is not as good as we think it could be, or even if you don't accept that, you could say it's always possible to continuously improve whatever we do. So for whatever reasons, there was expressed about 25 years ago maybe, when I was only 8 years old, of course, about 25 years ago, that was expressed that we needed to do something to improve the quality of care rather than just leave providers on their own delivering good care, rather than just leaving people on their own. So it emerged over time, especially as people did studies, research studies, or had inquiries and realized that the quality of care wasn't as it should be. It emerged that we needed to have different mechanisms to try and improve care. And accreditation is one of the favored ones. There's accreditation, we've lost count, but we've counted that accreditation of some form, standards, assessment against standards, and delivery of a judgment, a report or an award, is in something like 70 countries that we've counted. Accreditation in some form or other. So if you think about that as a problem, and you've got to solve that problem, then you can have different mixes of regulation or accreditation or working with people collaboratively to try and improve things. You could have everything from just leaving people to be civically minded, people to be publicly spirited and do things because they believe they want to provide good care, through to having legislation to insist, to mandate, to instruct people that they must behave in certain ways. And most of us are somewhere in between, and IKAS is somewhere in between those two models. I'm on page 7 already. Isn't that amazing? So what's accreditation? Well, it's the application of national or even internationally agreed standards for assessing and benchmarking performance. That's, in a nutshell, what accreditation is. And usually it means that the standards are assessed by surveyors or some self-assessment mechanism or some sort of data. And you've got a particular mix of those in your accreditation process here at IKAS. And who gets accredited? Well, you can accredit really anything that moves in the health system almost. You could accredit patient journeys or institutions or general practice or the private sector or publicly funded hospitals or whatever. And there's a mix of those in different countries.